You guys hear me?
It's a little quiet.
I'm gonna try to move my phone up a little bit. Can you guys hear me now?
Yeah.
So I'm Patty Velasquez with the Family Resource Center Association. I also have Jackie with me, so I'll let her introduce herself. And I would say my favorite food restaurant would be, it's hard to pronounce, but it's called Fritangas, and it's down in Alameda and Federal, and it's a Mexican restaurant.
Thanks, Patty. And is that Sandy Stenmark?
Hi, Sandy Stenmark, University of Colorado. Tables would be my favorite.
Thanks, Sandy. Jan?
Hi, my name is Jan Rhodes, and I'm with the USDA Food and Nutrition Service. And thanks for having us join. I just want to mention that we've had some transition with a lot of our staff. And so I apologize that the previous meeting we had someone else, but we're trying to get someone consistent in for these meetings. But anyway, with that, my favorite restaurant is, I live up near Fort Collins, so I would say Jessup Farms, which is up in northern Colorado.
Thanks, Jen. And Sandra?
Hi, this is Sandy Clark. I'm also with USDA FNS on the WIC side. So Jan is on the SNAP side of the house. I'm on the WIC side of the house. And it's so funny that he mentioned Pearl of Siam because I'm actually eating leftovers from there right now. And I was going to say my favorite restaurant is kind of any small ethnic restaurant, depending on the day. But Pearl of Siam is definitely up there with my favorites.
Cool. Thanks, Sandra. And we have a few phone numbers. I'm not sure who's on. So there's 0921.
Yeah, that's me. Can you hear me?
Yeah.
Okay. I'm Hannah from Benefits in Action, a nonprofit in Lakewood. We help out with SNAP enrollment. And favorite restaurant is a tough question, but I'll go with Cuba in downtown Denver because I was just there over the weekend.
Thank you, Hannah. And I think I missed Sarah Robinson.
Sarah Robinson, Mesa County Public Health. Not to get too classy, but I love the Waffle House.
And we have 7788, and then there's 3647.
Hi, this is Rebecca Dubrov with the American Heart Association, and I am getting hungry from all of these recommendations, but my favorite restaurant would probably be Hapa Sushi.
Okay, thank you. And was that a last person on the phone? Did I miss?
Yes, this is Rebecca Ornelas with HIGPUF, and I would probably have to say my favorite restaurant is Kachina Kalori in Cherry Creek.
Cool. Thanks, Rebecca. Anyone else on the phone? All right. Well, thank you, everyone. With that, we'll go back to the room to Gina.
Good afternoon, everyone. My name is Gina Febraro. I'm not a member of this group, but I am supporting Blueprints to End Hunger in partnership with Erin. I actually work at the Colorado Department of Public Health and Environment. So I'm kind of an in-kind resource. And I work in the Prevention Services Division. Erin? In our this Erin is one of my colleagues. And my role there is to do facilitation and planning support. So glad to meet you all. And my favorite restaurant, so many people have named them, but I really love North County, which is in Lowry. It's in my neighborhood.
I'm Kayla Frawley. I'm the policy manager at Clayton Early Learning. I'm here on behalf of Raise Colorado Coalition. And I probably have spent too much money at Lee's Asian Bistro in Lincoln Park.
Good afternoon, everyone. My name is Sam Volk-Jennings, and I'm here on behalf of Benefits Data Trust, or BDT. I just started working there actually about 3 weeks ago, so I'm excited to kind of join you all, learn from you all, and collaborate. I would say my favorite restaurant is probably Lowdown, right down in my neighborhood.
My name is Matt Krieger. I work for Denver Human Services for the Public Assistance Divisions, and I have to second the Cuba jealous that somebody got together this weekend. Not me, don't.
Good afternoon, Todd Jorgensen, also Denver Human Services. I'm going to cheat and pick two just because. One, newer, kind of fancy L5 Island, Middle Eastern. And all-time favorite, though, Casa Bonita. Come on.
Ken Barrows, Colorado Legal Services, is a vegetarian. I like Watercourse, which is right down the street, actually. And did you mention Plymouth? Mm-hmm. I live in the area too. They've been there a couple of years. They're very good as well. Nice to visit.
I'm Erin Kendrick. I am working at CPHE on the nutrition consultant for the WIC program.
Hi, my name is Samantha Dunbar. I live in Longmont. I'm the WIC participant, and I usually don't go to restaurants because I have two kids who are similarly allergic to foods. But if I were to go, I would go to Pho or Asian restaurant.
I'm Sarah Lipowitz. I'm from Colorado Center on Law and Policy. I live in Loveland, and our favorite restaurant there is Henry's Bistro.
Terry Chasen with CDHS. Fairly new to Colorado, so I haven't been to too many places, but I guess I would say I'm a carnivore, not a vegetarian. And my husband took us to the Buckhorn Exchange, and Buck too, and I just thought it was such a fun, maybe not for the food, but it was never fun.
My name is Brett Reeder, Director of Client Services for Hunger Free Colorado. I'm going to cheat you two as well. I'd say Domo is probably my favorite restaurant, though I have more often second favorite restaurant, Cosmos Pizza.
Mark Jacobson with Hunger Free Colorado, and I'm also very new to Colorado, so this is super helpful to learn places to go. I like brunch food, so one of the places I've enjoyed is Syrup.
Andrew Stricker with Trailhead, and I would go with Bill's Pizza.
Just sharing name, any affiliation that you want to share, and your favorite restaurant.
My name is Cora, and I'm a WIC participant. My two kids. My oldest is 8, and I've been with WIC since I was pregnant with my oldest. So I've been there since the checks, and now with the e-card, and it's beautiful. My favorite restaurant, I really like the Walnut Cafes. There's like the mini Walnut Cafe in Lafayette, and I really like it.
My name is Nick. I'm actually her brother. So I'm a SNAP recently new to the program participant, and my favorite restaurant I would say probably Pachi's Pizza or Chicago style.
It's because he used to work there.
Good afternoon, Misty. Oh, go ahead.
Good afternoon, everyone. I'm Erin Ulrich. I am the new implementation director for the Blueprint to End Hunger, and I'm thrilled to see this many faces around the table and this many voices on the phone, so that's awesome. My favorite restaurant, this was actually really challenging to come up with because we eat at Noodles as we eat out. My kids are also little. But I also live near the Plymouth, and I do love it. And they opened a dessert shop right down the street, and they fresh bake their pies every day. So it's an ice cream store.
So speaking of food, for those of you who are new, there's a bunch over here and coffee and stuff, so feel free to help yourself. But I think while we were going around, one more person might have joined us on the phone. Do you want to go ahead, introduce yourself, share your affiliation and your favorite restaurant?
Sure. My name is Laura Walker. I'm new to the group, and I am the Human Services Director in Larimer County, so up in the north part of the state. And I can't get past Idaho Springs without taking my kids to Bojo's.
Thanks, Laura.
All right. Well, thanks again for being here, for sharing your favorite restaurants. Took some notes. We have really two purposes for meeting today, primarily. We're going to hopefully have some time at the end for just general updates. But the first topic on our agenda is that we have Terry Chasen here from CDHS, who is going to be proposing One, and it sounds like a second rule proposal for SNAP participants. So this is a regulatory policy change that I expect both will probably be before the State Human Services Board on July 2nd, so next week. And so this is a great opportunity for Terry to explain what these rule changes are, why they're being brought forward, and to open it up to this group if there are any questions, any concerns, any suggestions. And I'm hoping that this becomes a pretty routine part of our work group, that when the state is moving forward with rule changes, that we can be a forum for feedback and for giving additional input. The second reason that we're meeting today is that between now and the last meeting, many of you took time to fill out a survey. And so we really appreciate you doing that. And the survey is still open, so for those who haven't had a chance to fill it out, there'll be additional opportunities to give input. But we wanted to share some of the major takeaways and the major themes. And this survey involves access to SNAP and WIC, as well as the client experience. What are the barriers, what are the issues that we see, and what are some possible policy solutions or programmatic solutions that we might want to help develop. And so this is really just the starting point of that conversation, but you'll see on the wall that, and I also have handouts here that I'll pass out, that capture some of the major themes from the survey, as well as some project ideas that stem from those. And what we really hope to accomplish by the end of this meeting is to begin the prioritization process and to really nail down 1, 2, maybe 3 projects that we think would be really meaningful and would be a good opportunity for this work group to get involved with.
And we're going to be bringing Gina in to facilitate that part of the meeting and help us figure out what we do with all these ideas. And so with that, we'll pass off to Terry as she's taking a big sip. Sorry.
Okay. As Jack Dunn, you mentioned, my name is Terry Chase, and I'm with the Colorado Department of Human Services. I'm the SNAP program manager. So these changes are in relation to the food assistance program. We do have 2 that will be presented to state board next week. One is an emergency package, which was not copied in, which was not sent on the agenda, sort of because it is an emergency and it's a quick rule. Last, I guess it was at the end of May, the legislature passed SB 1920, not 945. Gosh. This bill was related to hearings. For those of you who don't know, if a client who has applied for SNAP is not pleased with the result of their determination, or they think that something went wrong with the determination, everyone has the right to a fair hearing or to appeal that process. FNS requires that all states handle that hearing process from the date that the client appeals to the date that the client gets the result of their fair hearing needs to be no longer than 60 days. Since 2013, Colorado has been way beyond 60 days. At one point in time, it was closer to like 108 or higher. This last year, we've been through a lot of various activities to really try to reduce that time frame to get down to the 60 days, not only to meet the federal requirement, but also to benefit our clients in the counties by having that process completed quickly. The longer that process takes, the more potential overpayments for a client if they end up not winning the appeal. So it's very important that we get it as short as possible. So one of the projects was a lean process, some BPR between us and the Office of Administrative Courts. And we determined that there's some lag in our current process that was statutorily required that was actually causing a significant part of the delay in us reaching the 60 days. That happens at the point of, I guess to make it a little bit even more complicated, Colorado has a 2-tier system when it comes to hearings. It first goes to the Office of Administrative Courts and they do an initial decision, and then it goes to CDHS Office of Appeals, who read that original decision and basically issue a final decision. In between the first decision and that final decision, currently there's 15 days built in for any party to the process to file an exception to the first initial result. Okay. So it could be the client, it could be the county, or it actually could be CDHS could also file an exception. Right now, the current, the previous statute was the Office of Appeals had to wait 15 days for somebody to file an exception. When we ran the numbers, less than 5% of any of the three parties actually file an exception. So for 95% of our cases, we're holding them for 15 days for no reason. So cooperatively, CDHS, with help of Jack and Sarah, we were able to get a statutory change, which allows us to shorten the process in most of the cases. What it now allows for is within the first 5 days, any party to the appeal can file an intent to file an exception, which basically is a one-page form that says, I want to file an exception to the original finding. And then after they file that, they have the full 15 days to actually write it up and get it into the office, or OA, the Office of Appeals. What that will allow, then it allows us to cut 10 days off of 95% of the cases, which should help us meet our timeliness, and also then obviously shorten the amount of time that it takes for that final decision to occur. So long story short, the emergency appeal allows us to modify our regulations because of that new statute. So basically retains the 15 days to file an exception, but it adds this new 5-day window for any party to file the notice of intent. And then it retains the 15 days. Does that make sense? Any questions?
Just one thing, as an attorney who does these cases, that's actually a good idea, what I've heard, I think. But the no longer than 60 days, Sarah comes to our meetings sometimes, reported on it. I've had clients who, during the administrative hearing process, have been prosecuted criminally. And I don't think it's at all fair to say the administrative process should be done in 60 days when they've been charged. I had one client, it's a client error case, not even an IPV case. We're about to go to hearing 2 days before. I've just been prosecuted criminally. It's a big prosecution that started. So in those cases, I don't want to go to hearing until the criminal case is done. Otherwise, it doesn't really give her a fair
Point in
shot.
time, the client can request a continuance. Counties cannot. CDHS cannot.
Okay.
But
Is
clients can request
Which
a
we did.
continuance.
Okay.
That
Yeah,
would
I mean,
still
that's-
be the best route, I would.
Right, so there'll always be exceptions, not a lot, again, it's probably not even 1% of cases, but there is that possibility that they'll be criminally prosecuted.
Just to summarize, the 15-day grace period to file an exception, that's pretty important. An exception is just a fancy way of saying that you don't agree with the outcome of the appeal for various reasons and you want the case to get a second look. And it can take 15 days to really put together the documentation and outline the arguments for why you think the case warrants a second look. But from the state's perspective, they had to wait those 15 days before they could move on in every single case, even though very few cases actually file an exception. So with this change in policy, really the only difference is you still have 15 days to file an exception, but you have to let the state know within 5 days if you plan to. If you don't do that within the first 5 days, then you lose your opportunity to file an exception. And this is true for counties as well as clients. So does anyone have any questions, any concerns about that?
I have a question. So like I, as a participant, would be the client that could be in that situation? Is that something, it's an online form to fill out, like, hey, I need 5 days?
Yes. Okay. You can also get it from your county. You can get it from the Office of Appeals. I believe they have it online.
Is there going to be a link on the notice that people receive telling them how they can indicate their intent to file exceptions?
I don't know if there'll be a link, but there is information on where to take one.
The closest thing I've experienced would be more so like Medicaid, not so much with their or SNAP, but with Medicaid, I'm actually helping my brother with the denial letters he got, and it's really, they don't have an electronic process. It's phone, fax, or mail. And so I had to like type up a letter and make sure that he mailed it. And if we only had 5 days, he would have missed out. But that Medicaid, I think, is a little different, but knowing that there's an online way to reach out
So
would help
the
so much.
Office of Administrative Courts, who you can file your original appeal with, they are working on a new software package and an electronic system that will allow people to file online. I don't know that it's completely ready yet, but I do think they accept them electronically via like email and things like that. And they would also be handling the Medicaid ones.
Oh, gotcha. Okay.
So I think
So to
that's
me,
coming.
like 5 days, like sometimes I don't get my mail. Would I even know that?
You still have the longer period of time to file your original appeal.
Oh, okay.
This is for after you file your appeal, you've gone to the hearing, and the administrative law judge has made an initial decision. It's in that time
Okay,
period.
so you're way into the process. Okay, thank you. Sure.
And Terry, when will this become effective, assuming that it passes the State Human Services
So
Board?
since it's going in as emergency rule, it would actually be effective the day of board, so it'd be July 2nd if it passes. And then we go to board again in August for the final. But since it's going through as an emergency, it's effective immediately.
Will notices be updated the day it becomes effective?
We already have released the notice of intent. It's already out there. Counties have them. I need to check on the noticing. I don't know if we were able to get that updated as quickly, but
Okay.
system changes take a little bit.
Understood. It's just if clients are going to be subjected to that 5-day time frame
It's
starting on
already
July
been-
2nd.
It's already been added to any information when the actual, when the initial decision goes out, all of that paperwork has been updated.
Okay. Great. Any other questions or concerns before Terry introduces the other rule proposal? Okay.
All right, if you think of any, we can come back to it. So the other package is also going to board on July 2nd. It is just going through the normal process. It is a piece of changes. We have been meeting regularly with counties and other advocates in a few work groups to do various, what we're calling comprehensive updates, but they've really kind of been broken into different segments of updates. This is one that will be going into hopefully effect for October 1. We pulled out the most important piece in this legislation that we want to get passed, deals with a waiver that we have applied for and received approval from FNS. But then there's a few cleanups also within this package. It's a 50-page packet, so obviously I'm not going to read through everything. I have a high-level summary that I'm just going to kind of read. And then if you all have questions, let me know. So we have updated a few citations to align better with federal SNAP language. 2 of them deal with responsibilities of drug and alcohol treatment centers and what we call group living arrangements. Basically, when an individual goes into one of these specific living arrangements, there can be an arrangement between that participant and the actual center for the center to handle their SNAP benefits. And what that means is they might collect all the SNAP benefits for the 10 people or more living in the center, and then they use those benefits to purchase food, and then they kind of communally sometimes make the food together. These centers have to be approved by FNS, so it's only certain ones, they have to meet special requirements. But about a year ago, I can't remember for sure, 2 years ago, there was an update to federal regulation that changed how benefits are returned to the client. Previously, it had basically been if you were there for less than a certain amount of days, you would either get all of your benefits or a portion of your benefits returned. And then the initial federal rule changed that to be prorated based off of the number of days that you were in the center. They would then prorate the amount that you would get. Well, that initial rule got changed and it went back to what it had been prior, which was you get a portion of it when you leave. In between the interim rule and then the change again, we changed our regulations to match the interim rule, not knowing they were going to be changed back. So they were changed back, so now we're changing back to match the federal rule. So that was a long drawn explanation. The other update, as
for our federal clarification is when a client has overpayments that they have not repaid, after around 180 to 120 days, we're able to go to what's called Treasury Offset Program, which is basically FNS. We communicate to FNS, our federal partner. These are the people who have not paid back their overpayments, and the Food and Nutrition Service then basically intercepts the federal tax return to pay a portion of those overpayments. Currently, our federal regulation, or our state regulation says a claim is delinquent at 180 days. We are actually updating this to 120 days in order to match the US code per FNS's direction. So again, this is a cleanup required in order to align with US code and federal guidance. We have a couple areas within the regulation where we're just clarifying language. The main one is currently in our regulation, we refer to persons with disabilities as disabled in order to match the federal rule that still uses the term disabled when they are describing any special regulations around disabled persons with disabilities. So we had changed it to match the federal law a couple months ago, but per request to state board and other people, in order to be more person-centered, we have gone back to person with disabilities. But this time when we did this, we also went through all of our regulations to match it up. Before last year, for example, we had both. We had person with disabilities, and then throughout our regulations, we still use the term disabled. And so now we are cleaned up and matching. So anytime we refer to a person with disabilities, it's consistent without. We still use the term disabled in a few areas if it's attached to a specific program that is still using that title. Any questions so far? Okay, our biggest change, and as I said, the change that we have attached our time frame to of October 1, is in relation to a waiver that we requested and were approved. FNS approved that waiver for us. It's called the reinstatement waiver. Basically, what this waiver allows for is if a client is receiving food assistance benefits, and then in the middle of their certification period, we close them down for some reason. Maybe we received some information that maybe they weren't eligible. So we reached out to them and said, hey, respond to us so we know what's going on, but they don't respond. Or we received some other verified information that made them ineligible, and we closed their benefits. Currently, what happens in a situation like that, if your benefits have already closed, say they closed for June 30th, and something happens on July 5th, and whatever made you ineligible before, like maybe you lost the job that made you over income. Right now, the only option is to reapply for benefits. What the reinstatement waiver will allow us to do is, in that scenario, a person is denied, but whatever, or closed down, whatever changed, whatever was the reason for the closure has changed. In that example, they had a job and lost the job. Within 30 days, we can reinstate their benefits without an application. This simplifies the process quite a bit for everyone involved. It helps our clients, obviously, because we can reinstate their benefits prorated from the date that they provide us the verification. It also reduces the number of applications coming into our county offices, which also is a benefit to our clients. It's really that simple. It sounds like it should be more complicated, but it's pretty much that simple. As long as whatever caused the closure has changed, we just reopen you in your original cert period and move on. It could get complicated if there's another change that happens in the middle. We still have to reevaluate eligibility. So there could be times where a client is denied and that reason changes, but there's another reason that now makes them ineligible. You lost your job, but then somebody else moved into your household who now has income, you're still not eligible, then we couldn't reinstate you. But for most people, it will be a fairly easy process of reinstatement. So it'll be October 1, hopefully effective date based off of the regulation. We also have system changes in place in our eligibility system, so it should be up and running October 1. Actually, no, have a good one. Okay. We changed a couple of grammatical things. I'm not going to go into those, a couple spelling things, a couple numbering. Changes. We also had a few changes around the hearing process. Again, these are very technical. There were some places where our language was inconsistent. We did add language that requires the Office of Administrative Court, which is that first entity who receives the hearing request, that they must complete the hearing no later than 20 calendar days from the date that they receive the appeal. Right now, that's starting to happen because they have added extra hearing slots to their schedule, but this change will require that they actually hold that hearing within 20 days. And then we added some clarifying language. Again, it was just clarifying language around what is a final decision and what is an agency decision. But for 53 pages, that's basically it. Any questions?
People on the phone too. I hope you were able to hear that. I'll give you that first opportunity to ask any questions or make any comments. Okay, seeing none in the room.
I have a question. For folks that are sharing benefits if they're in a drug or rehab center, is there any oversight of how folks are? Okay.
Yeah, the counties help monitor that as well as FMS when they approve them as the retailer, but mainly it's the state counties have to monitor that. They're supposed to report out to the county who those people are, and then we should be doing a sampling of those cards to make sure that the benefits are being returned appropriately and used appropriately. So, yeah. Thank you.
Well, I have two comments to make. One is that I think this is an exciting rule proposal, particularly reinstatement policy. When Terry mentions a waiver, that means that we have to request permission from the federal government to be able to institute this policy and depart from federal regulations. And I think the motivation behind this is really commendable. We're trying to make it easier for people to re-return to the program without having to file a brand new application. I do think that the devil will be a bit in the details about what kind of verifications counties are going to be seeking in order to reinstate someone under this more streamlined process. And so I would encourage your department to consider what kind of training materials you might be giving to the counties with respect to those verifications. The other comment I wanted to make is just thank you for coming and presenting this. In the years that I've been spent working on SNAP here, this is a really promising development to have a state partner who's willing to come and meet with this group and to present on these regulatory changes and invite feedback. So I really appreciate you doing that.
And just to ask the question of the facilitator, knowing that's a lot to absorb for folks, is it an open opportunity to emailing you with questions or thoughts after people have a chance to process?
Yes. Yep, I think all my contact information is on the list. And you're more than welcome to come on the 2nd if you want to have any comment, either pro or con.
It's cool. Y'all should if you're free. It's a neat thing to watch the State Human Services Board. They're very deliberative and thoughtful. It really is interesting.
So we are continuing our regulation work groups on an ongoing basis, hopefully. We had hoped to have another sort of cleanup package in January. It looks like it might be early spring. So I'm sure there'll be more that I will be talking to you about. We also know we will have another emergency package probably in September. Every year we update a few of the We call them the cost of living adjustments, but basically it changes the federal poverty level or the income guideline for SNAP based off of federal changes. And then we also update our standard utility allowances, which is what we give households so we don't have to get actual utility expenses every month. We consider it standard. That has to be approved by FNS once a year and then changed once a year. We know what our SUA or HC UA is going to be, but we're still waiting on the COLA changes, which we don't get until the end of August. So it forces us to do an emergency reg, but that was annual and it's pretty technical, but I will still bring that to this group once we have those numbers.
Great, thank you so much, Terry. Any last thoughts?
Do you need support in a second?
Always. Yeah. Okay.
So instead of time on the second, go support the rule package.
And that's going to be here on Sherman,
Yep. 8th floor, Sherman Street.
1575 Sherman Street.
We can make sure to send that out after the meeting for everybody.
Yep. There's also information on the CHS website under state board and the agenda.
Is there remote participation for that meeting?
I don't think so. For people on the phone. Yeah.
You usually have to let them know a few days in advance if you want to testify by phone, and they can set that up.
But you can listen in.
You can definitely listen in either way.
All right, well, thank you so much, Terry. We're gonna change gear a little bit. We're passing around a document called the Themes and Project Ideas for our work group. For folks on the phone, this is the attachment to the email that Kevin just sent out today. So you can follow along via email.
And last week, everyone should have been emailed a copy of the full survey responses. I'm not sure if you would have had a chance to read it. It's about 10 or 11 pages. But for those who are interested in seeing every response that we received to the survey, it should be in your inboxes. And I think it's also, it's included. It's in this packet. It's in this packet for those who are here in person.
Yeah. So for those of you who are just joining us for the first meeting, between last meeting and this meeting, we sent out a survey asking about barriers and project ideas and different metrics that people were interested in looking at through this work group. So like Jack said, you all have access to all of the responses we got. We got about 20 to that survey. And the purpose of it was to sort of give us a starting point to think about what we can actually begin to move on and begin working on as a group. So this turns it into sort of an action team. So Jack and I went through those responses and did our best to sort of break down themes. And that's what this document is. We have a list of sort of top line themes that tend to be more issues that come up time and time again or barriers. And then under each of those themes, we've attempted to come up with various project ideas. Now, some of those came from other survey responses. Some of them are items that have just come up at meetings over the last several months, and some of them we've made up. So we realize this is definitely not comprehensive, but I'm just going to go through quickly to make sure we all understand various bullet points, and feel free to speak up if there are questions or comments or clarifications under any of these. And then we're going to pass it off to Gina to help us figure out what to do with this and how to actually narrow down with the goal of leaving today's meeting with, like Jack said, 1, 2, 3 project ideas that we can actually start working on as a work group. So I will jump in. The first theme that came up was stigma, particularly with participating in programs or with shopping with EWIC cards or with EBT cards. So we thought there are a few different ideas that could fall under that. One would be pursuing a federal waiver to allow for restaurant or hot meal purchases. I believe that's only available for older adults and folks with disabilities, but feel free to correct me if someone knows otherwise.
Yeah, and for homeless.
Oh, okay, and for people experiencing homelessness.
My understanding is may have been explored a couple years ago.
Okay.
I think there were some restaurants in Boulder who were interested. but they sort of backed out because it's still, the amount of the meal still has to meet the thrifty food plan, which is very low.
Oh. Okay.
We see this often in grocery stores too, as people get turned away at the cash register because they're trying to buy hot food. And that adds to the stigma. That's why we have it here under the stigma theme. And it's also a very direct barrier to food if you don't have a microwave or a stove or working appliances that can help you prepare food.
Yeah, so then, thanks for clarifying that, Terry. The other, this is kind of broad, but we have, working on the WIC shopping experience. So there's a lot that could fall under that. And I'm so glad there are a lot of people with experience with WIC here today, because we definitely, there's room to fill in ideas here. So that could be, WIC only stores or finding like a WIC only shelf. That's much easier to find all the food that, but there's a lot that could fall under that. And then the last bullet under that first theme is capping county fraud expenditure or ensuring procedural safeguards for fraud investigations. So that is, we think, sort of responding to stigma, because some of that comes from the fact that people then are dealing with claims and hearings or fraud investigations, and that can make for a really bad client experience. Any questions on those first few?
I would just, maybe it's a little late in the game, but when I do a case that, there's a dispute whether usually the father of the children has lived in the house. Mm-hmm. And it's very fact sensitive in a way. It really depends whom the administrative law judge decides to believe. But I don't know of anything, if you're talking that the possibility of fraud investigations creates stigma, if there could be some sort of directive, and it's usually women, but either parent applying about, there's another parent in this child's life, what's their role? How do they, when do they come over? Because there's just lots of confusion, and we end up with hearing packets, and often the father's, because the father may not be that stable, and the father's using the address for DMV and employment. And then DHS is going to go to hearing and say, hey, you're living in the house. And now, I have my position and I trust my client. I think a lot of times the answer may be, he's sort of there for a couple days and then not. And I know, all of us maybe don't plan that well, but if there could be something just to let applicants know, okay, the other parent, what's their role? What money do they give you? Be very clear. And when you apply, it should make sense. If you're applying and you're saying my income's $0 and my rent is $600, it makes no sense whatsoever. If there's some way for DHS to say, okay, your application makes no sense. Your expenses have to be pretty close to the money that's coming in from whatever.
Right. So thanks for bringing that up. I think we have something that could address that under a later bullet point. So we can actually skip ahead to that since you brought it up. So there's one theme called unclear eligibility requirements and variance among counties. And one of the proposed ideas under that is clarifying household composition. So right now, household composition, so who's in the home is determined based on who is living together and preparing and purchasing food together. But there's a lot of gray area there. So one of the proposals is to clarify that by further defining those two terms. Do you think that would address that?
I think it would, and also, and I've lost a hearing, we've dealt with this issue, but the regulation, I have to admit, is pretty clear. If the father of the children is in the house and the two parents want to claim their separate households, the regulation basically says you can't. If you're in the same household together, you're a SNAP household. And it would be nice if that were clear to applicants too.
Right, okay.
Just to lessen the confusion.
So it sounds like there's two related suggestions. One might be further delineating in regulation what it means to live together or preparing for purchase food together.
Right.
The other related suggestion is to have a flyer or a FAQ that can be attached to an application or distributed that would help people who may not be clear on how to answer that question.
Right, that's some upfront messaging.
Yeah, it's a good point. And one of the cases I had with living together was they lived in a single family house on separate floors. I mean, I'd love it in the law if it said, okay, you could be separate households if you're really not living together, if there was some sort of rebuttable presumption, but it's not in the reg now.
Thank you for that. So that's a new suggestion, and we are going to have an opportunity after Anya and Jack go through all of these to add new suggestions, but since you already shared it, can we add something?
Yeah.
Well, there are unclear eligibility requirements.
Or something, can you give me the language?
Maybe just a fact sheet. A fact sheet about household composition.
Okay, and then once you go ahead.
Sure. Okay, so back to sort of towards the top. The next one was inaccessible application processes and having to deal with a lot of verifications. So some of the solutions under there are more funding for application assistance, improved text message reminders or text communications. This is kind of SNAP specific, but an on-demand hotline for interviews. So it's really easy to complete that interview step of the application process. And then improving follow-up for cases that are denied for a missed interview or missing verification. Any questions on those? All right. The next was that we heard, this came up in a lot of the surveys, that benefits are just too low, especially the minimum benefit, which for a household of 1 or 2 is just $15 a month for SNAP. So one option would be to develop legislation that would appropriate state funds for a higher minimum benefit. And we would have to think through who that minimum benefit would go to. It might be that it's for older adults and people with disabilities or veterans. So there are details to work out there. That could also increase the fruit and vegetable allowance for WIC. We could think about including that when we think about increasing minimum benefits. So that applies to both SNAP and WIC. And then this one is, again, kind of SNAP specific, but doing some outreach to medical and child care providers to kind of smooth the documentation process for medical and child care expenses, which can be deducted from some SNAP cases. Any questions on those?
I'll just add it because the SNAP I do but another, I was giving a presentation to interns about a few days ago at CLS, and I just used the hypothetical. If an individual, it could be a family too, but they live with the parents, they pay the parents some rent for whatever it is, and they may want to know, okay, well I have to live with my parents and I want to pay them rent, but SNAP will cover all my food costs or all our food costs, right? And the answer, of course, as all of you probably know, is generally no. I mean, if it's a single person, that person might get the maximum of $192 a month, but that's $6-7 a day. That's all you have. But that's a situation they would get the max, but it probably wouldn't cover their food budget their entire food budget, which I know SNAP isn't meant to do right now, really.
Supplemental, but yeah.
What I'll say about that idea, at least in terms of increasing benefits using state dollars, it wouldn't be cheap, but it would be really helpful, I think. And it's not unprecedented. We'll talk about this more later, but there are places, New Mexico, I believe, and Washington, D.C., where they have used local dollars or state dollars to supplement the minimum benefit for particularly vulnerable populations, like older adults or people with disabilities who rely on SNAP. So when we talk about prioritization in a few minutes, keep this one in the back of your mind.
Jack's already making his point. All right, so the next theme that came out was lack of program alignment. We did not have any grand solutions under this one, so feel free to fill that in. As Judith said, we'll have an opportunity to add later. Next is sort of this I think is sort of related to what we talked about earlier with stigma, but a fear of benefit recoupment and overpayments. If you apply for the program and then end up with an overpayment, the likelihood of applying again is pretty low. Or if you hear from the grapevine, that happened to a friend, again, there's a lot of fear associated with applying because it sounds risky. So one option to deal with that is capping client error overpayments at 1 year. I don't know if you want to speak on that at all.
Right, so there's really three types of overpayments. There's administrative error, so the county screwed up. There's client error, which means the client screwed up, didn't report something, but it was an accident. They weren't trying to be fraudulent. And then there's intentional program violation, which implies that the client deliberately withheld information from the county in order to get higher benefits. And with that second group, where the client made an error, but it was inadvertent, the federal law gives states broad discretion to go back to 6 years, right there, 6 years, or as little as 1 year in terms of how much the overpayment is calculated to be. And in Colorado, we've elected to do the least client-friendly option. We go back the full 60 years, which in some cases, as Ken can describe, results in overpayments that are in tens, if not more than $50,000. We've seen some as high as $75,000.
Well, not a snap too much, yeah, but definitely a few 30s, 40s.
In any case, we're talking about amounts of debt that most clients are not going to be able to repay in their lifetime. And if they are trying to, it can only be sustained by docking the amount of SNAP benefits that they receive moving forward. And so one thing that would be a relatively low-hanging fruit, because it doesn't require legislation, would be our state partners entertain a regulatory change that would cap those client error overpayments at 1 year, meaning that we would only look back 1 year and not any further, calculating how much they have to repay.
And this also means that we're treating people who made an error the same as people who did it intentionally. In each case, it is 6 years. So
it's also tough as a matter of evidence. Who here keeps their pay stubs from 6 years ago? I generally don't. And so how am I supposed to disprove whether I actually was paid that amount 6 years ago? I mean, as an evidentiary matter, it's difficult to provide the documentation you would need to refute these types of claims.
Yeah, so this option is limiting how far we can look back just for those client error cases.
So Jack, as I mentioned earlier, we are continuing to convene our regulation work group, and we're working on that new package for the spring. And currently our intention is to.
All right. Yeah.
All right.
Positive feedback.
So would it be helpful now or in the future to have the support of this group? In other words, should it continue to be included as an option up here, just so you could say, and this was one of the top priorities.
Any of that support is always helpful as we're going through the regulatory process.
Sure.
I have already drafted an advocacy letter around this point, so maybe I polish that up and Blueprint takes a look at it. Would you like to use that as our submission?
That would be great, I think. And then to Terry's point, even if the state is on board with this rule change, individual counties might very well not be so keen on it. And so to the extent that we can provide her with additional cover and support for this, I think it could still be very helpful.
So that could very well be a project.
It could.
To get
It could
organized
still very well
around.
be a project,
Okay.
yes.
Yeah, I think we should leave it up there. But that's great news. Thank you, Terry. On to the next, inaccessible appeals process. So one option would be conducting SNAP appeals trainings for prospective advocates. So kind of like outreach partners help with the application process. This would be training navigators to help with the appeals process for people who are appealing a decision on their case, or perhaps, Then another option is to develop a public database of prior SNAP appeals decisions. Right now, those are not publicly available, I believe. So it's hard to use precedent in those cases. Do you have anything to add to that, Jack?
They're supposed to be public record, but the state doesn't publish these appeals decisions in any meaningfully accessible way. And as a result, if you're going into an appeal, even if you know that the same issue has been litigated in the past, you're not going to generally be able to know how the state resolved that issue. And so you have to keep re-arguing the same issues over and over again. Other states, like New York, for example, have a public database online that you can search by keyword. And they redact personal identifying information, but you can search SNAP sanction for work requirements and then read all of the appeal decisions that involve that issue. And so you can go into your appeal armed with the knowledge about how similar cases have been decided in the past. And that's really important. That's not even SNAP specific. That's true for Medicaid. That's true for any public benefit program that relies on the Office of Administrative Courts. In Colorado.
Another option there is implementing an automatic review of notices for legal sufficiency at the beginning of an appeal hearing. So this, I'll let you talk to it again.
This is a cooler issue than it sounds. This is really a sexy issue. So in the past, a couple of years ago, the state passed legislation around Medicaid. And it was limited to just Medicaid, and there's a legislative reason why that was. But one of the bills that passed requires an administrative law judge to look at the legal sufficiency of a notice at the beginning of any appeal. Because if you're appealing your SNAP decision, you have the right to due process. And that includes the right to be properly noticed about why your benefits are at risk of being lowered or terminated. The problem is that most people aren't represented by a lawyer, and you're not going to know that you're entitled legally to proper notice. You're not going to know what proper notice necessarily means. Many lawyers don't know what has to be in a SNAP termination notice, for example. And it's an affirmative defense, traditionally, meaning you have to raise the issue, otherwise the judge isn't going to consider it. So what this bill did is it tells the administrative law judge, no, you have to look at the notice at the beginning of every appeal, regardless of whether the client raises the issue or not. And if they read the notice and it's deficient, let's say it doesn't articulate the reason why benefits are being terminated, or doesn't say what date they're to be reduced, then the judge gives the client the option. You can either have the case dismissed temporarily pending the receipt of adequate notice, or if you feel like you're ready to argue on the merits, then you can go forward with your appeal. But it's at the client's discretion, and the judge has to do this automatically. And so it'd be great to see that kind of procedural protection that's afforded to Medicaid clients similarly offered to SNAP clients. Ken, I don't know if you have anything to add.
No, SNAP notices, you can jack differently, but the SNAP notice requirements aren't as stringent as some of the others, like old age pension. But you still have to, have what regulation, regulation it is. And so I haven't had a lot of, usually the notice is adequate, I have to say, on SNAP, or that's been my experience anyway.
Okay. So our next theme was that Peak is not very user friendly, and this is another where we didn't solve it, but are open to ideas. Transportation came up a lot in these surveys as a barrier. So one option there is expanding telephonic signatures to counties. Telephonic signature allows, right now, SNAP application assisters to help someone submit an application over the phone. It allows, so for example, on our Hunger Free Colorado food resource hotline, we can read someone their rights and responsibilities, ask a few questions, and then it allows us to sign the application and submit it for them. The option to expand it here would be, say, having a county call center also able to do that. So someone could just call into their county call center, submit their reapplication or their recertification over the phone, complete that interview all in one phone call. I don't know the bounds exactly of what could work with WIC. So I think this came up a lot with WIC as well. So think about that. Churn is another theme. So that's when someone leaves the program and then ends up coming back onto the program for whatever reason. So sort of people churning on and off the program. It's not good for clients who lose benefits for a period. It's also hard on counties that have to reprocess that application. So one of the options under that is improving the recertification and periodic report forms for SNAP, because we find that people don't return those forms and then it results in churn. Another theme that came up was burdensome work requirements. So for the SNAP program, certain populations need to be completing a certain number of work hours or work training hours, and can be sanctioned if they're not. So we came up with advocating for a fully voluntary employment first program. Right now, counties can opt to run a mandatory or a voluntary or sort of a hybrid program. One would be codifying additional exemptions to the ABOD time limit. This is super wonky, but basically making sure that people who should be exempt from those work requirements are, and making sure that's in regulation and very clear, and perhaps expanding that to some other populations, for example, victims of domestic violence. And then seeing if there's opportunity to automate any of those exemptions, make it really clear so that mistakes aren't made where people lose benefits. Fear related to immigration status came up a lot. And we think, part of that would have to be a messaging campaign. So that might be some collaboration with Work Group 1, which is working on building will around hunger. And then one option would also be thinking about how we train county staff and frontline service providers to be talking about this issue and talk about access to benefits. Lack of awareness came up a lot. Again, that's we could respond with a messaging campaign, and we might be thinking about working with Work Group 1 on that. And then we, at a previous meeting, Jack came up with the idea of a client-to-client referral bonus program, because we all agreed that when, the most effective form of outreach is usually when your friends tell you about something. So
I've gotten a handful of people to oh really, it's that easy? Oh really, it's that low? Oh, okay. So yeah, I'd be like, I'm all for a referral.
And then finally, poor customer service came up a lot. So one option there is improving access to call centers. So that could be a statewide call center, expanding office hours. So making sure that offices where people can get these services are more available especially during non-work hours. Looking into virtual hold technology, so county phone lines that have long wait times could have the option to get a call back instead of having to stay in the queue for a really long time. And then finally, the final option under that is auto-generating receipts for documents that are delivered in person, because we see a lot of lost documents and things like that. So we sped through those. Any questions?
One comment, one question. So, question was on-demand hotline for interviews up on your second theme there. Can you talk to us a little bit more about what on-demand means?
Sure. So I think, there's a lot of, we might be blending some definitions here, but essentially, when someone, there are a lot of different procedures that counties use when someone needs to complete their interview for the SNAP application process. And what this is saying is having a line that someone could call into and be able to complete their interview when they call in. So instead of rescheduling, we're gonna call you back next Tuesday at this time, you call in because you can do your interview right then. But we realize that, that takes some flexibility for a hotline. So
and some counties also, I think, are candidates, call in and not call you back next Tuesday, but call you back in an hour.
Sure.
So there's different gradations within here. So, okay, thank you for that. And then the comment I had was the text message and reminders under that same one. It might be worth mentioning that under the churn as well, recertification.
Oh, that's a great point. Yeah.
A lot of communications around when things are due and getting those back in.
Thank you.
Related to that, I just want to flag this for our state partners. In the survey responses, a number of people mentioned that they're still being asked to do interviews in person, which is not the requirement, and that was a little troubling to see that.
Yeah, there's no requirement to have a face-to-face interview. It's telephonic.
All right.
If the client would like a face-to-face interview.
Right. Thank you. So we're going to pass it off to Gina.
All right.
To help us figure out what to do next.
Thank you to Anya and Jack for all the work they put in summarizing your ideas and adding additional ideas. As you can see, there are a lot up here. So what I would like to ask at this point is, does anyone have any compelling, so we're not at a brainstorming phase because we kind of did that in the survey. So any compelling additional project ideas that are not included up here that you think this group would have a key role in moving forward? And that goes for the folks on the phone too. I welcome you to chat any ideas and maybe let us know what theme you would associate it under. So this is, we don't have a whole lot of time. I'm going to get into what this process is going to look like in a moment. But since we're on this nice roll, I want to ask, does anybody have any additional project ideas?
Quick question. Yeah. Do you mean under varied eligibility requirements? Initially, a lot of my friends are they're shift work or self-employed. So when you ask how much did you make last month, they don't know. Is that something you mean that could be added, helping define income requirements to varied income things?
Yeah, I think that could probably fall where we put clarifying household composition, where we added the fact sheet. You know, I think that could maybe fall into that unclear eligibility requirements and variance among counties, like better laying out.
For example, my brother is a server, and so his income is totally related on shift work. So
right,
if we work together to try and make sure he's either in the income, or some months he's out and some months he's in. So it's like trying to figure that out.
The policies around that are pretty complicated, so I can definitely see where it'd be helpful to have a fact sheet. I don't even understand how all the income is calculated.
I have a friend who he's self-employed, so well, you know, he makes $7,000 in like November of last year, but then he gets actually paid that in like March of the year, but that's actually to cover a 6-month period, and he was super frustrated that he had no idea what that meant to like how much did he make last month.
No, it would be a good idea. These are cases I see too. Always self-employed, whether it's LLC or you're just a sole proprietor, you know, there's often bookkeeping issues and sort of, it may be a pain, but I'd recommend to anybody, if you have a business, you be very strict about and have different accounts. And a lot of my clients haven't set up a personal account. Pay yourself a salary, basically. So you have your income coming to the business, you're spending to the business, have that in one account. Then same time every month, say, okay, what can I put into my personal account and do that? That's hard, but without other guidance, it's the first thing I would suggest.
So any other new ideas? Thank you so much for sharing that.
I wonder if this would fit under an accessible application process. I particularly think about WIC and in more presence of WIC in childcare centers, like particularly our Head Start and early Head Start centers where we know that the populations are all eligible. And if we could have an enrollment process through the family service workers, the community engagement specialists, whoever the families are working with for their liaison and advocacy, to just sign them up as they're doing their 2-hour enrollment anyway.
It's a fair way to say that, like co-located with other programs.
Yeah.
Great, thank you. Other ideas not represented up here that you think would be an important focus for this group? Going once? I know there's already a lot up here, so I think the hard part is not going to be generating more ideas, but probably narrowing them down. So a few things just before we really dive into the prioritization process is planning and prioritization can be really difficult. I think we all know that. We've all been in strategic planning processes of one sort or another, or even planning for your own personal life and what's most important at any given time. So I just want us to all kind of acknowledge that and be in that space. We also have, I'm not sure how many people total, but probably upwards of 30, and we have 45 minutes. So I'm going to try my hardest to honor group process and get us to potentially 1 or 2 defined projects. I'm not 100% confident I can do that because of the size of the group and because I want to allow people enough time and space to actually think and have conversations and dialogue. So what I will say is that sometimes you can only plan so much around this until you see where you wind up. So I will say we'll get as far as we can and hopefully honor people's voice and give everyone an opportunity to weigh in. And if we don't make it where we want to be, we'll just pick up in the next meeting and we'll just keep going. So in terms of what the process is going to look like, sorry, this is class. Basically, after having new ideas, we're going to use a method whereby everyone is going to essentially have $1 to spend, and you can go into 5-cent increments. So it can be 5 cents, 10 cents, 15 cents, 75 cents. And you can choose as many of these project ideas as you would like. Just keep it at 5 cents. Don't do like 72 cents or like 7 cents because it'll be too hard to add up. Okay, so you can spread your dollar across which ideas. The criteria I want you to think about are feasibility and impact. So feasibility means the resources of this group, potential funding, which is a little bit unknown, it always is, Opportunities for alignment with maybe what else is going on in the environment. Political will, community will, thinking about state, local agencies, legislators, all participants and clients, kind of their will. So be thinking about all of that. The other thing you want to think about is impact. How much impact is each of the ideas I'm choosing going to make on the goals of the blueprint, essentially? And the goal of this group, from what I understand, is to improve and promote policy to ultimately expand access and food security.
To increase enrollment in SNAP and WIC. Yes, but
Okay.
last meeting we talked about this group wanted to do that. through
Increase
policy.
enrollment in SNAP and WIC. That is the goal of this group. Okay, so that's important to keep in mind. So which of these different project areas is going to make that impact? Be thinking about that, be thinking about your dollar. We have limited resources, so the dollar is almost like a symbol of that, so we can't do everything. The other thing I want to revisit is I looked at your project charter, which Anya and Jack said haven't really been used consistently, so I want to run by some decision-making practices with you and make sure people are on board. So the facilitation is designed to aim for consensus building throughout and to arrive at that one or two project with a consensus building approach, including folks on the phone. With that said, if we can't get to consensus, this is a very large group and we have very limited time, are people okay with a majority, kind of a 2/3 majority vote, so not 51%, but like 70%? So if most people are in favor of those one or two projects, are people comfortable moving forward with that? And if you could chat in on the phone, if you're comfortable with that, I'd appreciate it. And in the room, if you could give me a thumbs up, thumbs to the side, or thumbs down, as to if you're comfortable with aiming for consensus, but if we can't get there by the end of this meeting and we think we're close, if you're willing to go with a 2/3 majority vote on what projects we'll work on. Are people okay with that? And knowing these ideas came from a lot of you in the survey. So part of the problem of doing this is we don't have consensus, we don't have a decision-making method to decide. So, comfortable. Okay, as long as I know people are comfortable. Thank you. Yes. Anyway, that's the importance of a project charter. Okay, so all that to say, here we go. Is everyone ready?
Question.
Yes.
So with increasing enrollment being the primary goal, some of these things are really important, but may not necessarily be the most efficient way to drive towards that. So I'm thinking in particular benefits are too low. That'll have an indirect impact on increasing enrollment, but it's super important in my mind because higher benefits will make a really big difference for those who are already enrolled. So I'm just wondering how we want to handle that as a group.
Can I, so on the packet you all have, on the second page, it has how we get there bullet points. And this is a little bit more specific in articulation of what this group's goals are. And the fourth bullet point there says increase the WIC and SNAP benefit levels so that low-income individuals can afford the actual cost of purchasing sufficient, nutritious food relative to the cost of living. So I would probably say that in addition to access and improving enrollment in SNAP, that benefit levels and even client experience we had talked about at the last meeting are also within the purview of this work group.
Okay, so maybe we should clarify what is in the purview.
Yeah, so do you want to share where that document came from, where those bullets came from, and make sure we have consensus on those? Because I think that's a great point. Thank you.
Sure. So, and I think what might be causing some of the confusion is that like initial enrollment versus at any given time, the number of people eligible for a program are enrolled in it. So that includes things like people actually staying on the program once they get onto the program. That's a big challenge with WIC, right? Once the infant turns 1 and we're not giving, or the baby formula is not an issue anymore, the benefit level goes down so low that people don't necessarily think it's worth their time. So enrollment drops. So it's not necessarily the application to enroll in the program or just that, but it's also how many people are enrolled in the program at any given time, which has a lot to do with client experience. I think in terms of the document, I can give just a quick, like 1-minute overview. So the document comes from the Blueprint to End Hunger. So there were about 39 different stakeholders across the state who came together for over a year to develop the initial document. And this work group is really brought together to think about how we are going to execute strategies to get us further on that goal.
I have a question. Will this ever change or will it always stay the same?
That is a great question. And the answer is TBD.
Okay.
I mean, I don't think there's such thing as a static document for 5 years from now. We'll still continue to be relevant. So
I was just wondering, the second bullet we've already achieved.
I know.
We haven't achieved 100%. That's why I was.
So if we check off all these strategies, we'll definitely change it. Yeah, we are still kind of figuring out what that process will look like, a modification of the document, but absolutely. This is a guide.
Sorry.
Yeah.
So thanks for bringing that up. So impact for what? To what end? And it sounds like these bullets in front of you are kind of your touchstone to be thinking about impact. The other thing I want to say is there's a lot of changes. There's a lot of iterative work happening with Erin doing her role, the advisory council, all these work groups. So there may be some things you see as recommendations for other work groups that you think are important, but you wouldn't necessarily put your money on it for this group. So if that's the case, I welcome you to just walk over there and write up like Sigma. Well, I really would love work group 1, 2, or 3. Does everyone know what the different work groups are in this room?
Not off the top of my head.
Yeah.
Do we want to maybe do a quick review? I can write them up so people remember. Just really quickly.
So verbatim, no, but I can give you the general. You can probably say verbatim.
Yeah. So work group 1 focuses on building public and political will to end hunger. Work group 2/3, the goals for 2 and 3 are combined, but it focuses on increasing communities' access to food through their communities or through community-based organizations. Work group 4, we're here right now. And work group 5 is on maximizing child nutrition.
I'm going to ask you to write those up here because So think about what might seem like a better fit for other work groups. Think about feasibility, think about impact. What other questions? Any arguments people want to make before you get up? Erin?
Not an argument, but might be missing, I feel like, improving cost referral strategies between programs.
Where would you like me to put that? Under which?
Yeah.
I think that fits there. We might not have phrased it perfectly, but yeah.
Thanks, Erin. Okay. So folks on the phone, if you're participating actively versus just listening, I encourage you to look at the Word document that Kevin had sent out earlier today. It was at 12:30 in your email. And go ahead and just chat on here your project ideas and your amounts. And then when we tally everything up, we'll include yours in the process. Because your input is important even though you couldn't be here today.
Do you want us to spend our $1 on the handouts we have here or up there?
I'm going to ask you to all come up here. I also encourage you to get snacks and use the restroom. To the right. To the right is the restroom. Thank you. Okay, so I'm going to give everyone like 5 to 7 minutes to really kind of work through this. Just write it down. Yeah, just write it. Just write your reason. Really get a little messy. We'll see how it goes. I don't know. I'm going to write a little bit.
Kevin? Kevin, it's Sandy. Can I just send you an email with mine? My chat isn't working.
Yeah, of course.
Thanks.
Thanks, Andy.
It all depends on what project. Some of it,
You can use pen, or if you want to use marker, that's fine. On the projects before. So on the bullets themselves, so we're trying to use projects. I didn't sit down and I didn't read them. Yeah, so these are items like that.
Okay, so we're gonna see how I'm doing it? It's time for.
And then like, don't wait hearing. Just so you know, the inaccessible one is at the end, where it shows up second on top. I was like, I didn't think that would bump us out.
Yeah.
Oh, okay.
Well,
I don't know.
That was the one. No, no. Let's go game plan first. We have to be strategic about this.
10 on that.
It's kind of fun.
This is kind of fun. I can dig this. I like it.
It's time for this list.
You think so?
We need to cook at the project level for Anya and Jack's recommendation, not stay at the high level. Because otherwise we won't be able to define specific projects. We'll be still at this theme level. So I would like you to put your money on the bullet points, not on the dark, bold themes, okay? So everyone's clear. Thank you.
I know, but the impact, I guess I assume that.
Please do that.
But we could get.
I guess we're doing 100 credits.
There's some more right down here.
The same thing as markers.
Okay, yeah, I mean
If you want to be strategic.
Kevin, did you see the chat about sending the document?
Yeah, I sent it. Thanks.
I'm gonna steal from this one. Just look at it. The thing is, it's just like, we could do some.
We put these packets together.
Yeah, so if someone you trust. Yes. Yeah, no, yeah. I agree. There's some other areas that you can get. Yeah. I'm sure we want to overlap some of these. Yeah.
my house? Yeah. If you're on the phone, please feel free to chat your responses to Kevin or email them so we can include them. Don't put it all in one place, as they say. Yeah, man. Right. That's a good idea. You already Jack would have a first time.
Jack, you had a lot of 5 cents going around, all your ideas?
You can see, I marked up ahead of time. I had a few.
He planned ahead.
Yeah.
Oh, you're fine.
Couldn't plan on it.
Couldn't put down the referral bonus?
Oh.
Okay, just about 2 more minutes, and then we're gonna move on.
That would have been a fun one to work on. How's that one doing?
Oh, nice. We're just putting them up there. Directly.
Oh, is that what you want?
That's great.
Okay.
I didn't even think of that. It's even better.
Yeah.
Putting the ones from people who aren't here right up on the sheet.
Trying to, if I can find.
I can help you. What do you
This one, is there additional?
Happy berries.
Oh, thank you.
Good. We're going to new up together. It's nice. Yeah. You first started, were you at the old place?
Yeah, for like 3 weeks.
Okay. Yeah. Nice windows, the hotline. That's good.
Yeah, no, it's nice space.
Good neighbors.
Good neighbors, yes. But,
I need to come over and visit.
yeah, we're building over. Like I saw that.
Yeah. We just got our new ED starting last week.
Okay.
Oh, I got the 11.
Okay. Yeah.
Okay, last call. Has everyone had a chance? Okay, let's go ahead. Can I have Jack, Anya, Aaron? We're gonna do some adding.
Okay.
Ready?
I'm still trying to find.
Okay, so you're still doing yours, Anya?
Yeah, but I'm almost done.
Eugene, I'll tell you what, I'm gonna mark down on this master document here with the total.
Yeah, can you circle them? Well, I want to do it in
Yeah, we can do both.
here. Just give us one moment, folks. Check your phones.
You're doing in blue?
Okay.
Yeah. Oh, let's do it.
Okay, do you want me to start the other end? Great, yeah.
Yeah, I'll start in the middle. Oh, yeah, me too.
But I.
Well, yeah. Yes.
We talked about it as and then I went out again.
Okay, so I'm gonna need some help from folks. There's a lot up here. What do you see? I'm gonna have people looking up here and then telling me, what do you see that's over $1? My intuition is telling me the dollar or the most popular idea is $1 and up. And I'm gonna write those down. Tell me what you see that's under $1.
Read that to you?
Sure.
Okay, fund application assistance.
Okay, go slow, please, so I can write them down. Fund application assistance?
Yep.
And how much did that have?
$1.15.
Okay.
Or maybe more if Kevin added something.
Go ahead, next.
Now there's up here, peak not user friendly, total of $1.25.
Thank you. I got it. What's next?
Improve cross referral coordination.
How much did that have?
$1.45.
Ching, 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 ching. Okay, what's next?
Fully voluntary employment first program. Received $135.
Voluntary employee first.
Employment first.
Employment first, sorry. Okay. Yeah.
Expanding telephonic signatures to counties. Received $150.
Oh.
Okay. Signatures. Okay.
And then text message reminders and updates.
What did that get?
I got 140. And then last, the only one at above $2 at $2.20 was legislation to establish a higher minimum benefit.
How much is that? $2.25?
$2.20.
$2.20. Legislation to establish higher benefits.
Mm-hmm.
That's good.
Did we get all of the ideas over $1? I think.
Can you add 25 cents to peak?
Yep.
It looks like there were also a lot of notes on the stigma.
Yeah. So, Kevin, did you get these into?
No, that just came in right now.
These
But
just came
also,
in.
I
Okay.
think
Okay.
she used more than $1.
Okay. Patty, it was $1 total, so we would just need you to.
20 cents on each one.
We could do 20 cents on each. Sure. So, you want me here?
So application assistance is $1.35. The higher minimum benefit will go to up 20 cents.
Okay. So there's obviously a lot of great ideas up here, and we're going to document all of this and where the interest in the group was. I arbitrarily chose $1. Do we want to scan for any like 90-cent ideas or 95 or 90? You know,
I didn't see
any really compelling close ones?
The fact sheet.
The fact sheet had 85, and actually the one under it had 40, which is kind of similar. So
Yeah.
Do you all feel comfortable saying that has kind of 125 in its entirety? Okay.
I'll just call it household composition clarity.
Okay. Okay.
Seems there could be a series of fact sheets that would be really easy to crank out.
Yeah. Any others that come up really close? So how do folks feel with, so this would be essentially phase one prioritization. So taking all of these ideas and doing one phase of narrowing to these 8 that we would continue to explore. These are not like the final 1, 2, or 3 that we would work on. Are people comfortable leaving what was up there? Not that they're not great ideas, but we need to narrow. Are people comfortable with this process as a means to move now forward with these 8? And maybe we'll just do a thumbs up, thumbs down to the side so I can kind of see where people are. Thumbs up means you're supportive of using these 8 to move forward. Thumbs to the side means you can live with it. Thumbs down means absolutely no, you're like, you really want to see one of these other ones move forward. So, and people on the phone, if you could let me know where you are in terms of your thumbs. I can't see you. And then I am going to mention the stigma piece too. Okay, we have a lot of, actually almost all thumbs up. The one thing we didn't talk about yet is these recommendations for other work groups. I heard from a couple people how important the stigma piece is, and just wanting to call that out. I wanted to assure that we share that with work group 1 in some way. So I don't know who can be responsible.
That is one of their strategies too when they're planning out these marketing campaigns, but we can make sure to share that with them. They're actually meeting tomorrow. So
That's great. And then there's also a couple recommendations for maybe work group 5. So maybe we can share that as well. Does that sound good? Okay.
Yeah.
That's great. Thank you. If you think of any other recommendations for the work groups, you can also let us know after this meeting and we can share those ideas from this group as well.
also one other thing really quickly on that, but I know like there's an awareness campaign for SNAP and WIC here. That's actually what the meeting is about tomorrow, is improving SNAP and WIC marketing materials. So if we extend an invitation to this group, but if you ever want to join, just let me know. We'll add you to the list. Thanks.
Thank you. Okay, thumbs up. All right. Thanks, Patricia. Okay, so the next step here is to think about feasibility and impact more intentionally with these 8 ideas. So what we're going to do is I'm going to ask for some assistance from somebody here in the group who might be willing to help me. And we're going to write each of these ideas on a large Post-it. And then I'm going to have the group talk through this prioritization matrix. And I'll explain what this is. So I'm running like this. Yeah, you're going to do that for me. Thank you so very much. Appreciate that. So, for those of you not familiar, a prioritization matrix helps, and I apologize for the folks on the phone if you can't see me that well. But a prioritization matrix helps us consider for each idea what the impact on a scale of low to high and a feasibility on a scale of low to high, where you feel like this priority sits. So really what it does, it's not about where you put it, it's about the conversation that will inform the decision making about which ones you want to prioritize moving forward. So this is just a discussion. We only have 15 minutes left. The evaluation is going to come online after the meeting. And I don't know if you want to maintain time for member updates or if you want to keep going with it. So just to check in on the agenda. Because this would be a good segue for the next meeting. We could pick this back up and just turn it over to member updates.
I think maybe that makes sense and give people some time to sit with these 8 ideas and think about it. I know I need time to think
homework
about it.
between meetings for people to think about kind of pros, like some pros and cons and discussions of these 8 ideas. And then, or you could even do another survey. Or
Yeah, we'll think about it. I think there will be opportunities between now and the next meeting to get some feedback remotely. And so if we can save a little bit of time for general updates, I think that'd be great.
Well, I just want to thank everyone for your participation. And I like to do something to kind of acknowledge and reward your participation and the progress you made. You have 8 great ideas, and that's called a clomp. So if people stomp and clap on 3 at the same time, It's a celebration. So let's try. So we're gonna do it on three. 1, 2, 3.
Okay. Thank you, Gina. Appreciate it. So I wanted to open the floor now. If anyone has anything at all, any updates or any information that might be of interest to this work group. Any fun events coming up involving food security?
This is Karen Kendrick with Colorado WIC. We received notice that we were awarded some funding from the Colorado Health Foundation for the program to help improve our WIC enrollment rate and centralized referral process. It's helpful. So we'll start piloting that. But the goal is to have somebody at the state office following up on a number of our counties, the WIC referrals that we received through the online referral form and through PEAK. And so this person will be contacting them directly and trying to contact them sooner maybe than our local agencies can. And hopefully it's a warmer handoff. People know the program really well, so they'll be able to answer a lot of questions, and ideally we'll have them scheduling that first appointment. So it's more handled. You're now starting that whole process of getting physician prescription process. So, and we're also looking for technology to be able to use. We can text, just text, phone, and email options. So we have to communicate.
Congratulations.
Yeah.
And I'm Sam with BET. Just started, so I'm trying to get my feet wet and so happy to be here to meet and work with you all. One thing that I want to mention that we'll be starting is our new benefit launch. So it's actually an online eligibility screener where it takes about 1 to 3 minutes where someone can go online and kind of just see if they are likely eligible. Right now, just for SNAP benefits, and then it would direct them to the easiest way of enrollment, either on the phone through our Colorado Benefits Center, so they can apply over the phone. Would also either direct them to an in-person county location that might be easiest for them, and then they can also do it online, which would then we would assist them filtering through using PEAK as well too. So we're hoping to launch that. Launch date is the end of this month, beginning of next month. So we're working with a lot of the county offices to let ground people know, coming out with like a demo video, frequently asked questions, FAQs, to assist in that process as well. So I'll pass more information once we get the ground running with that. So.
I had one, Todd, Denver Human Services. Thanks. This might be redundant to an email that Kevin was kind enough to send out on my behalf. I just wanted to let you all know that Denver County is getting closer to launching our SNAP recipient advisory committee. And right now we're in the recruitment phase, and so could really use any and all of your help in identifying folks that might be interested in participating and sharing their experience with Denver SNAP, all things related. Do have to be a Denver, either former or current recipient, former being within the last, I think it was 6 to 9 months, we said. But we're really excited about this. This was one of our big recommendations that came out of the Staff Access Task Force for Denver County. And Kathy Underhill, former executive director for Hunger Free Colorado, is helping us putting this together. And then she has agreed to facilitate the meetings during the pilot year, because we really want to try to, Denver County really wants to help set this up, but also have an arm's length attachment to this so folks feel comfortable sharing their experiences with us around SNAP. So trying to make it as attractive as possible. I already did the hard sell with Nick over there. Gift cards, childcare, some other aspects, because we know this isn't an easy thing for folks to do. So, so I sent out those applications. Some of them have been, they've been translated into Vietnamese and Spanish. We also, because we're a bureaucracy as we are, we require this consent form to talk to us via email, so that's included as well as just a kind of a one-page info sheet. So if you didn't get that and you'd like to, let me know. But love to have you send any of those our way.
What's the time commitment each month?
I'm trying to remember. I think we said no more than monthly and likely more. Well, no, I think it was monthly because that's right, because this is the pilot is for the first year, so we do want to get a fair amount of meetings in. So I believe it's monthly, an hour to 2 hour meeting max.
I have a question about that. I know I had referred a parent to you recently, but I'm wondering, is there maybe a flyer or a document that I can just bring to the Head Start Center that we have at Clayton,
Yes.
so that families that I don't know maybe can just contact you directly?
Yeah, that's great. Absolutely. I
Okay.
can send that to you.
Great, thank you.
It's just SNAP, it's not WIC.
It's just SNAP, but for now, we're really hopeful that this is going to, well, we do know that, folks that are participating in SNAP oftentimes are in one of our programs. We serve 1 in 3 Denverites, mostly through Medicaid. But if this goes well, which I'm really hoping it will, we do plan to kind of expand into broader kind of customer feedback on some other assistance programs as well. But the scope right now is SNAP.
Okay. I just want to pass on a standing reminder that if you know of other people who may be interested in attending this work group or that you think really should be at the table, that all are welcome. And this was a great turnout today, and hopefully it was a productive use of all of your time. But to the extent that we can bring in even more people and more perspectives, then please spread the word. And you can connect them with me or Anya or Kevin. We can make sure that they're included on the email list. I think our next meeting is scheduled for July 22nd. Same time, same place, 1 to 3. And so I'm hoping that some of you return next month.
And there may be some homework between now and then.
Yes. And I can give a quick update too, just on, I know a number of you have filled out the survey that I sent out in my first couple weeks. And I will be getting kind of a summary of that feedback and input that I got from all of you out, hopefully by the end of the week, along with some of the next steps that we're going to be taking, both in the program office with the governing council and with the work groups and work group chairs. So thank you so much for providing that. I got survey responses from close to 40 people and also had one-on-one conversations with about 40 people. So it's been a very productive month. But again, I think there were some really strong themes that came out of that work. And I heard again from a lot of you around kind of ways that we can think about our structure and our roles and responsibilities and kind of transparency and all of those things moving forward. So you will see something from me with the summary results of that, as well as again the next steps that we're going to be taking. But feel free at any time to reach out to me directly, particularly if you feel like there was input that you gave that wasn't addressed. I want to make sure that that's an iterative process, even knowing that, I'm going to be spending the next couple of months really kind of solidifying out those roles and responsibilities and getting an implementation team in place. We're still not going to have it done perfectly. So continue to provide that feedback. I appreciate it. And we'll hear from you soon.
Yeah, well, thank you so much, everybody. We'll make sure to send out the list of 8 so we can all mull it over, as well as the State Human Services Board meeting information, which I believe is next Tuesday. But otherwise, have a great month. Thank you.
Oh, yeah.
So happy to be here. Anybody else? I would also maybe use this opportunity to say we really appreciate the state coming to this work group. explain it in that feedback. Also,
There's somebody that's like,